What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, March 26th, 2024. If you're new to my channel, this is where we do the daily pandemic update on COVID, but we also talk about other viruses as well that could be a threat to you, with the main one being COVID. Today we're going to talk about COVID, a little bit about Mpox, and we're also going to revisit some data that we recently looked at to give an update on that data. So if this is the type of thing that you're interested in, and maybe you just want to keep yourself informed, keep others informed, or stay safe, well, subscribe to my channel down below. It's the best way to do that. If you like this content, by all means, give it a thumbs up. If you think others should see this content, by all means, share this with anyone you know. And of course, if you have any comments, leave them down below. All right. Something has been going on since August of last year, and it's not a good thing. And it continues to happen here, right here in the United States. Over 1,000 Americans have died of COVID each week since August of last year. In a few moments, we're going to take a look at the weekly BNO update. I can tell you right now, yet again this week, it's over 1,000 deaths have occurred. They're starting to come down, but we haven't been able to break that streak yet. And I don't know when it's going to be. Hopefully it comes soon. Hopefully it comes maybe next week or the following week, but I can't say yes or no to that. So again, 1,000 Americans have died each week since August, late August of last year. Just terrible, terrible news. All right, in New Zealand, teachers and healthcare workers most vulnerable to long COVID, and new study shows. That makes sense because teachers, well, they're dealing with kids, and, schools, they get crowded. It's a high, close contact setting, and healthcare workers, well, they're working with people who are sick. Some who come in for COVID, so therefore, yes, it does put them at risk, and plus, they're dealing with a very stressful job. It's a very high energy job. I mean, of course, yes, long COVID. It is a big risk because, first off, they're at a higher risk of getting infected with COVID to begin with, which automatically, the more times you get infected with COVID, the higher the chances are of going on to develop long COVID. In Virginia, they're having problems with Mpox. This is not good. This is something we have to keep an eye on. Mpox cases on the rise in Virginia, officials say. Get this. We're only in March of this year. We're almost in April. So far this year, the state of Virginia has reported 12 cases, the same number it reported in all of 2023, according to Brandy Darby, the director of Virginia Department of Health, Division of Surveillance and Investigation. So this is not good. It says the cases have been spread out across the state, but again, they have already reached a total number for 2023. So Mpox. Maybe it was a little less last year. Well, it was. While there was that big wave in 2022 across the United States, guess what? It's trying to make a comeback again. So this is something we'll have to keep an eye on. We'll have to see if other states have this same issue. Taking a look now at the weekly numbers from BNO News, and we do have some good news to report here. And that is, first of all, new cases. While this does not include cases that would be estimated by Wastewater, this is reported cases, also does not include these at-home tests, these things right here, the at-home COVID test. The number has come down, and this is good to see. New cases, 97,352 new cases have been reported this week. The average is 136,429. That is down by 22,000. States reporting is at 50 out of 50, but as you know, a lot of this is estimated numbers for some states. In the hospital, 11,785. That's a good number. It's down by 1,000. We want to see that continue to come down. In the ICU, 1,395. That's down by 208. And new deaths, 1,116. I can feel it. Just a few weeks from now, I can feel it. We're going to have a week where we finally get under 1,000 deaths in 1 week in the United States. That would be a huge milestone because it's been a really long time. August 26th of last year is when we started this 1,000 a week pattern that we've been stuck in. And the average is 1,434. That is down by 114. All right, the breakdown for this week's case numbers. Again, reports are for 22 states. Estimates are for 28 states. COVID indicators continue to decline across the U.S., with weekly cases dropping below 100,000 for the first time since July. This trend will likely continue for a while until a new wave begins. And I'm not going to go out and say when the new wave's going to be. Will there be any conflicts caused by Easter, spring break, the Holy Week activities? I don't know. I don't know when it's going to be. At some point, there will be another wave. I mean, what goes down will not go down forever. So eventually a new wave's going to come. I just don't know when that's going to be. During the past week, 10,719 Americans were hospitalized with COVID, down 21% from the week before. Nearly 12,000 people are currently hospitalized, and I do think this will happen. I think we'll get that below 10,000 before the next wave comes. We're looking at a good bet that could happen right now. We'll see. Fingers crossed. This is the 28th week in a row with more than 1,000 new COVID deaths, or nearly 47,000 deaths during the same period. That's a lot of people, my friends. So far this year, nearly 2.8 million cases of COVID have been reported in the United States, causing 234,000 hospitalizations and 23,204 deaths. Yeah, that's pretty bad number. All right, taking a look now at the latest air quality values. Let's refresh this so it updates, and you'll see here, not terrible everywhere. There are a few areas that are problematic. One of them being North Carolina. Not sure what is going on in Charlotte, North Carolina. Your air quality here, it really sticks out. When you look at this map, look at this. We have some reds, we have some oranges. Not good to see. The rest of the east is not doing terrible. Little minor problems in southeast Pennsylvania. I'm not terribly concerned about that. Denver, Colorado, you're a little bit concerning. And the rest of the country, not bad, with just the usual spots in California. Of course, it's not coming up right now, but yeah, there you go. Just matter of fact, it's actually better than normal. It's actually better than it was a couple hours ago when I looked at it. So that is not bad for the West Coast today. All right, taking a look at Philadelphia EMS calls. A little bit higher for Monday. It was 739, but again, that is far away from the 800 level, so I am not terribly concerned about that. Taking a live look in at the Philadelphia suburbs, this I am a little bit concerned about. There's currently 16 calls ongoing right now in Montgomery County, and I've been looking at this from time to time in Montgomery and Chester County. It's been a little bit busier today, so that is not good. Fever call, altered mental status, flashcations, fall victim, respiratory emergency, another respiratory emergency, abdominal pain, stroke, subject in pain, on and on it goes. And there is another stroke listed down there, so that is not good to see. In Chester County, yes, this continues here. Look at this. Wow, this is not good at all, actually. I should probably grab a screenshot of this and tweet it. Look at that. 4 respiratory emergencies, 3 sick people, a cardiac arrest. Yikes, what's going on in Chester County right now? Yeah, not good to see. There could be a mini surge going on there. We do know that Wastewater in Montgomery County, Pennsylvania, this is Chester, but Montgomery County, Pennsylvania is starting to rise slightly. And with that, let's take a look at BioBot real quickly. There is some new data from BioBot. All across the country, all 4 corners of the United States right now are dropping. Even that Midwest rise that there was, that is starting to drop as well. But we come down here to Bucks County, Pennsylvania. Let me pull that up. Remember last week there was that real wonky rise in Bucks County, Pennsylvania? Yes, that did occur. But now look what's happening. It's dropping. Bucks County, Pennsylvania, it's dropped again. So that wonky rise that they saw, it didn't last. It just went up and then it went down. Still don't know if that was legitimate or not. And BioBot nowadays, you got to be real skeptical about their data. Incidentally, look at this. Bristol County, Massachusetts, dropping. Bristol County, Rhode Island on BioBot, they're rising a little bit. Let's come down to, we see Chester County, Pennsylvania, because we just showed you that. Yeah, look at this. Chester County, Pennsylvania, according to BioBot, it's rapidly dropping at this point. But again, we take a look at current EMS calls. You can see here, yeah, that's concerning. 3 sick calls at once. Multiple respiratory emergencies. There were 4. I'm seeing 3 now. But the point is, it's busier than we've noticed recently during the pandemic update. All right, Walgreens today. Just going to briefly look at this because Again, we're back to states not reporting. Not a lot not reporting. It's not as bad as it was a few weeks ago, but it's enough. 15.1% positivity this week. The prior week was 15.5%. Difference of down 0.4%. Total test 7,913. Prior week is 9,375. So, yes, testing is down slightly, but again, I see not one, not two, not three, 4, 5, 6, 7, 8, 9, 10, at least 10 states that are not reporting. If they all reported their Walgreens data, if all those stores reported data, there would probably be more tests. It would probably maybe closer to 9,000 tests. I don't know. But we do see here there are some isolated areas where there's just a lot of red. Like, for example, Louisiana, Arkansas, Missouri, Iowa, even Minnesota, orange. Look at that, straight in a row. What's going on in Louisiana? Let's see. Well, the current week, there's 18.6% positivity. The prior week was 14%. That is a difference of up 4.6%. Total test, 86 versus 100. Testing's down. Could it be that all these states are seeing lower testing? Let's see. Arkansas, 10% positivity rate this week. Prior week was 5.7%. Difference of up 4.3%. Again, testing is down. 70 versus 88. Does that continue into Missouri? Yes, it does. So, as you can see here, a lot of these states are red because of testing. 18% positivity rate this week in Missouri. The prior week was 10.5%. Difference of up 7.5%. Total COVID tests, 172 versus 210. Why is California bright red? Let's find out. 14.9% COVID positivity this week. The previous week was 12.3%. That's a difference of up 2.6%. Total test, down 208 versus 276. Then we come over to Maryland, which Maryland is, wow, big increase. 16.9% this week versus 14.1% last week. That is up by 12.8%. So that's a fairly big increase, which is not good to see. Total test, 89 versus 98. I mean, it's not a significant drop in testing, but it's enough. And they're not doing enough testing, so therefore it's enough. It caused the positivity rate to rise. Let's go back to the West Coast. Washington State. Look at this. In Washington State, 26.4% this week. The prior week was 20.9%. That's actually up 5.4%, and testing was flat. So you might be seeing some sort of a rise in COVID cases at this time based on Walgreens data. Wastewater would suggest otherwise. Alrighty, we'll do some more states again tomorrow. Continuing back to wastewater now, we do want to take a look at what's going on with BioBot and not BioBot, wastewater scan. Let's take a look at a couple sites here. Let's go up to Portland, Maine. We have not checked in with you in a while, and in Portland, Maine, COVID, it's dropping. You know, it's slowly dropping. It's not rising at this time. RSV, not many issues with that. Influenza A is dropping at this time. Influenza B is now flat, and it's very low at this time. HMPV, no issues with that. Norovirus continues to remain high, and I do agree with this calculation. It is over 100 pathogens detected still, so that is not good to see. Mpox, no issues with that at this time, and wow, a lot of hepatitis A detections at this time. Let's go somewhere into the central regions of the United States. Let's go to Arkansas. Let's see what's going on with Harrison, Arkansas. Remember, this site had a big norovirus problem about, maybe almost 2 months ago now. Well, let's see what's going on there. COVID, it's rising slightly. That's not good to see. And remember, if we go back to Walgreens for Arkansas, Arkansas did have a rising COVID positivity rate this week. So that's interesting to see. RSV at this time is low. Influenza A is low, but it is rising ever so slightly. Taking a look at what's going on with influenza B, that has dropped to low levels at this time. No Mpox detected. And norovirus, though, be it's still coming in at high, it is dropping at this time. Hepatitis A, there are some detections ongoing back from February. Alrighty, continuing on now, let's take a look at some CDC data. And we can see here, only one place in the United States for flu has epidemic status, likely growing, and that at this time is Kansas. It is dropping everywhere for COVID. COVID is not growing or likely growing in any state in the United States at this time. It's either stable or uncertain, likely declining, or declining at this time all across the country, even in New York State. All right, continuing on now, taking a look at the latest variant. We'll get an update on this on Friday. JN.1 comes in at 86.5%. JN1.13 is at 9.5%. Then you have JN1.18 at 1.8%. Taking a look at New Jersey for today, and we do have to go to the hospitalizations page, and we will find that there are 247 hospitalizations in New Jersey. That is not a full and complete number because only 65 out of 70 hospitals reported, but hey, the number continues to drop. It's a good thing. Yes, it would be slightly higher if the other 5 hospitals reported, but it's a number that's continuing to drop. I'm starting to wonder if they can get below 100 before a new wave starts. On the ventilator, 13. In the ICU, 38. Discharges, they had another 18 discharges. Take a look at New York State. This is a really good number. 351 people tested positive. That number continues to decline. Again, does not include these at-home tests, but hey, it's a number that is declining at this time. And another number that is declining at this time is the hospitalizations in New York State. COVID hospitalizations are now down to 609 with 73 people in the ICU. Yes, this is some good news. Hopefully we can get them below 500 in the near future, or at least before the next wave starts, which again, I don't know when that's going to be. And take note here, COVID hospitalizations in New York State. Yes, they're not dropping as fast, but at least did not last week. But look at this. It's starting to pick up the pace again and dropping. So this is really good to see. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. We'll have another Pandemic Update probably again tomorrow. Don't hold me to it. If not, it'll be on Thursday. But there's more pandemic updates to come this week. If you enjoyed this update, you learned anything, give it a thumbs up. You want to see more content like this because you want to keep yourself safe and keep others safe, subscribe down below and share this with anyone you know. And of course, if you have any comments, leave those comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.